Hi, my name is Bree and I work with the great team here at Sparkle Dental. Today I'm going to explain to you some of the pregnancy myths floating around and when the best time to make an appointment with the dentist is. Staying healthy during your pregnancy will help ensure that your baby is healthy too. There are many myths surrounding pregnancy and oral hygiene. Although you will have a lot to think about, caring for your teeth and gums is very important and should not be left. It is important for everyone to have regular dental checkups and cleans to maintain good oral hygiene. It is best to see a dentist prior to falling pregnant, as you can do any necessary dental treatment then. If you are already pregnant or suspect you may be, make an appointment to see your dentist so you and your baby can get off to a good start. Make sure you tell your dentist you are planning a pregnancy or are already pregnant. Some of the pregnancy myths you may have heard of are: gums always bleed during pregnancy, a toothache should only be dealt with in the second trimester, losing a tooth for every child, there is no need to see a dentist if I can't see or feel there's anything wrong, and my oral hygiene will not affect my baby's health. These are all not true. I'll now explain a little more detail why. Myth number 1, gums always bleed during pregnancy. Hormonal changes in pregnancy can lead to an exaggerated response to bacteria and plaque. For some women, the plaque can build up quicker on teeth, and if plaque isn't removed, it can cause gingivitis. Gingivitis starts off with swelling and bleeding of the gums, and if left can lead to gum disease, also known as periodontal disease, which affects the jawbone. Myth number 2, a toothache should be dealt with in the second trimester. The second trimester remains the ideal time to have a toothache seen to. It is not the only time though, especially if you are in pain or there is infection. Pregnant or not, deal with emergencies immediately. You do not want infection to harm your baby. Myth number 3, losing a tooth for every child. Periodontal disease is a chronic bacterial infection of the gum tissue that supports your teeth. The bacteria thrive in the gap between your gum and your tooth, causing the attachment of tooth and the supporting tissues to break down and tooth loss can occur. Myth number 4, there is no need to see a dentist if you can't see or feel that there's anything wrong. Just because your teeth look fine doesn't mean they are fine. Some cavities do a pretty good job of going unnoticed. Assuming that everything's fine just because you can't seem to feel or see anything's wrong is very dangerous and can get very expensive very quickly. One thing to remember, a lot of dental issues start off being painless. When you get pain, sometimes it's too late. By not seeing your dentist regularly, you risk developing serious dental problems. Myth number 5, my oral hygiene will not affect my baby. Pregnant women who have periodontal disease may be 7 times more likely to have a baby that is born too early and too small. Research is still ongoing, but appears that periodontal disease triggers increased levels of biological fluids in the body that can induce labour. Several early studies have found that treating periodontal disease during pregnancy may significantly reduce the risk of preterm birth. Here are 3 things to keep in mind and practice before, during and after pregnancy. Nutrition, having a healthy, well-balanced diet with plenty of protein, calcium, vitamins A, C and D, with fruit and vegetables. Brushing and flossing your teeth twice a day using a soft toothbrush and toothpaste with fluoride, and regular 3 to 6 month dental checkups. Pregnancy should be an exciting time, but it won't be if you're experiencing toothaches or gum problems. Seeing your dentist during and after your pregnancy, and especially if you're experiencing any discomfort, will help ensure you have an enjoyable pregnancy. Here at Sparkle Dental, we'll be happy to help you with any concerns or questions you may have regarding your oral hygiene, and also when to start thinking about your baby's oral hygiene. Please feel free to watch our YouTube video on when to bring your child in for their first dental visit. For more details, please contact our friendly front office team on 9300 2622 or go to our website www.sparkledentaljumba.com.au. Thank you.